Hello, this video is a brief introduction to the Achilles systems. Let's start with Achilles doc. First, go to the login page, you change to English, and you insert your email and password and sign in. Then let's start it with SX, which is the feature for signs and symptoms. For instance, let's suppose that the clinical syndrome you're suspecting is a cystitis. Once you click in cystitis, the usual symptoms will appear here, and then you can choose either from the presence or absence of dysuria. If you click once, the button consider that there is presence of the symptoms. If you click twice, it will consider the symptom it's not present. Let's go back and click the button once. Then you'll see that the probability of the bacterial infection rose in 10%. If you have augmented urinary frequency, it will add 30%. If you have suprapubic pain, it will add 9%. And if you have no vaginal discharge, it will rise 7%. By the end of these sums, you have an 89% probability of urinary tract bacterial infection. Then you can save as a draft or go to generate prescription. If we do generate prescription here, it will pop up a message saying that your data is incomplete. You do not have an interface with the laboratory information system. This Achilles will ask you the infection origin, which is community acquired, and then patient's detail. It needs at least this range. Let's say it's a young female. And then you can now inform it the patient is pregnant or is breastfeeding. There is also a probability to calculate the SOFA sepsis risk and also renal function if needed, or if the patient has any drug allergies, comorbidities, or if it's receiving any current or prior antimicrobial. But for clarity and speed, let's just prescribe the antimicrobial here for this patient with this information. In a few seconds, the system will go to the back end to the information of many patients and will run an algorithm and state the clinical context of your patients. And based on epidemiological data, the most probable successful drug is nitrofurantoin, which is an access drug that can be given per us, and it's part of the our access antimicrobial. Second place, fosfomycin, and on third place, amoxicillin with clavulanic acid. Well, if you're going to choose the number one option, you just click prescribe, and the system will give you all the information for you to review if everything's okay, if everything's accurate, and then you can print, and will pop up on a report where you can print or send it to your patients, even with electronic signature. So this is about the main functions of the SX or X. But you can also choose here from the Artemis vision. The Artemis vision uses all epidemiological data plus 20 other parameters to identify which is the most confident antimicrobial for prescribing. Let's see that here on first option is still nitrofurantoin, second option is still fosfomycin, but in third option you got trimethoprim sulfamethoxazole. So you can prescribe either one of those, but let's say we're going to assume that nitrofurantoin is the best one like we did in the other option. So it's a very intuitive, very easy, and in a few minutes you can end up discovering which is the best antimicrobial in your region, in your city, in your clinics, to your kind of patients. So it's the best antimicrobial for the right patients at the right time, compiling with the antimicrobial stewardship rules.